This is the moment when we have begun together to wrestle it to the floor. And so it follows that this is the moment of opportunity. This is the moment when we can press home our advantage. It is also the moment of maximum risk.
To those many, he said, would look at our apparent success and want their ancient freedoms back now, he had this message.
I refuse to throw away all the effort and the sacrifice of the British people and to risk a second major outbreak and huge loss of life and the overwhelming of the NHS. And I ask you to contain your impatience because I believe we are coming now to the end of the first phase of this conflict. Contain your impatience.
I personally just believe that we should have kept the economy going, used our common sense, keep a bit of distance in.
They might as well just be patient. Yeah, it might affect the economy for a few months. It might take a year, but at least this is lifted. The COVID is gone, hopefully, and we can get back to normal.
Signs of the uptick in traffic on the M25 this morning. Boris Johnson wants to show he shares the desire to lift the controls. But his team knows he must have credentials as a man who won't take unnecessary risks with that judgment call. He said even when indicators on deaths and infections are moving in the right direction, we will still emerge only slowly from full shutdown.
Then that will be the time to move on to the second phase, in which we begin gradually to refine the economic and social restrictions, gradually to refine restrictions.
That phrase a far cry from talk of an exit strategy, a phrase now banned in Whitehall. Boris Johnson instead today talking about maybe gradually altering some restrictions. He doesn't want expectations to get out of hand. He was one of the strongest voices in government warning about the dangers to the economy of a shutdown. And today he warned if there aren't big moves to switch the economy back on, we may not have an economy as we know it.
I know that without our private sector, without the drive and commitment of the wealth creators of this country, there will be no economy to speak of. There will be no cash to pay for our public services, no way of funding our NHS, no cash.
That message could be rolled out a lot in the future if the public proves reluctant to return to the workplace when that moment comes. For now, as in Nottingham today, there's more building work than there was a week ago, some sites reopening, some never downed tools. In Westminster, the Chancellor tried to plug a gap in his rescue plan for business, offering small firms up to £50,000 in fast-tracked loans, with the government picking up the interest for the first year.
I'm pleased to say that these loans will be available from 9 a.m. next Monday. There will be no forward-looking tests of business viability, no complex eligibility criteria, just a simple, quick, standard form for businesses to fill in. For most firms, loans should arrive within 24 hours of approval.
The government also announced that NHS workers and social care workers who have died after contracting COVID-19 in the course of their duties would receive £60,000 from the taxpayer. The Department for Health said 82 NHS workers and 16 social care workers are thought to have died while helping victims of the pandemic. Gary Gibbon, Channel 4 News, Westminster.
So now, is Boris Johnson right to resist the loosening of lockdown restrictions? Let's speak now to the entrepreneur John Caldwell, who co-founded Phones for You. He's among a group of donors to the Conservative Party who have asked for the lockdown to be lifted. And Professor Sian Griffiths, an expert in epidemiology, who led the Hong Kong government's investigation into the 2003 SARS epidemic. She joins us now from Oxford. John Caldwell, thanks indeed for talking with us. The Prime Minister has effectively rejected your call for him to lift the lockdown. What's your reaction?
I don't know where you've got that from. I have absolutely not called for the government to lift restrictions at all. What I've suggested is a new method of lifting restrictions when the time is right. And that method would be to do small sample sizes, either in counties or cities, so that we can track the epidemiology of it and understand the consequences of relaxing the controls. That wasn't a call to relax the controls straight away. That was a call to, when we get round to relaxing the controls, to do it in a methodology where we've got models to go off to provide more data, more epidemiology and more understanding of what we were doing.
Well, look, hypothetically, let's suppose that the city of Chester is found to be completely free of the virus. Would you advocate lifting the restrictions on Chester tomorrow?
Well, that wasn't really the point. The point was to take a sample size, either a county or a city, where we decide that because of the epidemiology, it's reasonable to start removing the restrictions, and then monitor very heavily the consequences of so doing, in order to then roll that out throughout the rest of Britain, but only when the time is right.
Sean Griffiths, Professor, how does that strike you?
I think it's very sensible to think about smaller areas and understanding the disease, because we know the disease can be silent, so you really need to know that you haven't got silent cases in the community before you lift lockdown. Otherwise, what will happen is you'll get that second peak that people talk about, and we've seen that in other places. We've seen it in Hong Kong, we've seen it in Singapore, where they've thought they've gotten control, and then they've seen another peak and had to reintroduce lockdown measures, and in fact sometimes some more severe lockdown measures. So I think it's worth us taking this slowly, understanding the epidemiology. The epidemiology is essential. We need to understand how many people in the community have had the disease, and whether they are immune, and those are not necessarily the same thing. We need to understand that we don't have cases in the community, and we also need the capacity to test. So we need to know that if cases should arise, we're able to do that detection, to trace and to treat those cases, and to isolate them and break the chains of infection. So we need a good infrastructure before we move towards lockdown, and we won't be going back to normal. We'll be going to a new normal. It'll be different, and it'll change over time, and will change probably in the light of the science as we understand more and more about the disease.
But very briefly, just take the example that I suggested to John Caldwell just there. If an area was found, an area of one of these segments of the country that you decide to look at, if that becomes clear, could it be lifted tomorrow?
I don't think tomorrow would be an appropriate time. We still have too many cases in the community. We haven't met the 5 criteria. And we do need to have the systems in place to do the track and trace, and we need to learn from other places. So if you look at other countries across Europe, you'll see timetables set out, and I would like to see more discussion about what might the timetable be, what might it mean for schools, for example. So you might not just go for Chester. You may say, let's get preschool children back, let's get kindergarten children back, let's get infant children back. You need to make those decisions. You probably wouldn't just go for a geographical location alone. You'd add in a whole bunch of criteria.
John Caldwell, I suppose there's a philosophical issue here too. Can a business interest ever be worth the loss of a human life?
I don't think that is the dynamic here now. I think the lives lost of coronavirus, of course, are tragic, but we mustn't underestimate the damage that there's going to be to human life as a consequence of unemployment, mental health issues, and depressions that are going to follow this virus. So this is not about lives versus money. This is about lives versus lives. And I do think there's a sense of urgency to get the economy going again, but only within the criteria that I've already stated, which is studying the epidemiology, making certain that the time is right, and then releasing various areas of the country to test what happens in order to hopefully roll that out throughout the whole country and get Britain back to work again. But I do absolutely agree that it's not going to be life as we knew it. It's going to be a new life for the time being.
What is it the time is not right for another 3 or 4 months?
Well, I don't think that's likely. What we're seeing now with the incidence of new infections and the reduction in deaths suggests that the time will be right in the next week or two. We need to see what the statistics show. But if we carry on in the right direction in the same way that we are now, I would suggest that things should start happening in the next couple of weeks. But what I would really like
let me
to
just
see
put
from
let me
the
put what
government
you've
is-
said to Professor Griffiths. Let me just put it to Professor Griffiths. He thinks perhaps in a couple of weeks, 2 or 3 weeks.
Well, if you look at how we've been tracking the disease alongside Spain or Italy or France, and you then look to those countries and see what they're doing, and they've started to introduce different types of release of lockdown. The Spanish children were allowed out for the first time today. The under-16s were allowed out for the first time today. Tomorrow in France, we know that the Prime Minister is about to lay out the next stages of the plan. So I think what we need to do is to have the discussion about what are the stages we need to go through. Are we going to get some sectors back first? Are we going to get the schools back? Is it some geographies where the incidence is much lower? How does it all fit together? And then how is that release of lockdown supported by the epidemiological surveillance that we've both been talking about?
Right. But now, John Caldwell, you are a Conservative donor as well as being a fine entrepreneur and, industrialist. Are you disappointed in the way that the Conservative government have actually handled this crisis? Do you think they were slow off the mark, didn't take any note of preparing things in 2016 and the rest?
Well, you can always retrospectively say there's disappointment. One of the things I am disappointed in, I don't think the economic package was enough, and it wasn't enough and it wasn't right. And I've been campaigning now for 5 weeks for the government to make 100% guaranteed loans from the bank at a very low rate of interest. I am absolutely delighted that after my call to Rishi Sunak last week, that he has now decided to do that. And I think that's a great step forward for the economy, because the lifeblood of Britain's future is these small businesses which can go on to grow and create jobs. And it's vital for Britain's future. And so the announcement today that is made is absolutely fantastic for Britain's future.
But Professor Griffiths, though, I'm still not quite clear what the balance is in the end between lifting and industry's interests of simply getting on with the job again.
That's a very difficult question, because you have to continually weigh up all the different factors. So how many cases have we got? What's the risk to the population? What's the risk to industry? As you said earlier, being out of work, of course, has its own health consequences. The mental health stress of being in lockdown, there are consequences. All of those things are discussed. And I think that you'll see, I think what we're asking for is we're asking to see a pathway, a framework in which we can see that we will come out of lockdown, but it will be different. And we may have to accept that if cases arise again, if we get a second peak in the autumn, we may have to go back into lockdown again. So this is a moving
Professor Griffiths, I'm sorry to cut you off there, but thank you very much indeed. And it does seem that you and John Caldwell are at least agreed that both of you want to see a framework.
Yes, would like to see a framework.
Now, throughout the worst days of the pandemic, we've been focusing on frontline workers who've lost their lives to COVID-19. Lani Zuniga was a nurse who had been working in a care home in Surrey. He died on Friday after 3 weeks in intensive care. Tomorrow, his colleagues will hold a minute's silence in his memory. Anya Pop has been speaking to people who knew him.
Well, Arnie, I would say he's a very brilliant person. He's very warm, loving.
Lani Zuniga moved to the UK from the Philippines 12 years ago. After contracting coronavirus, the 54-year-old nurse was admitted to the same hospital as Boris Johnson. But unlike the Prime Minister, Lani never came out.
I thought he's going to recover. I even thought that he's negative for COVID upon seeing him.
Arnold Barrientos first met Lani at nursing school in the Philippines. They became best friends. After falling ill at home, Lani reached out to his old friend to ask if he could come and stay with him in Oxford. Scared for his family's health, he had to say no. Instead, Arnold drove 2 hours to drop him some food. It was the last time he saw him.
I'm a little bit guilty because it seems like he's helpless and he really wants somebody to help him. But I just cannot say yes easily because, I'm taking care of my family. It's so hard for me, Yeah, that's why I wanted to make up for that.
Arnold is now trying to raise money for Lani's funeral, but the timing of his death couldn't be crueler. After 12 years, he got citizenship this year and qualified as a nurse. It meant he finally had enough money and rights to bring his wife over after all these years of living apart.
The requirement of the Home Office nowadays, you have to have a certain, your salary should be in a certain bracket before you can get somebody, a dependent from the Philippines. So I think that's why he pursued nursing again, so that it will be enough for him to be able to get his wife. And of course, he hasn't seen his wife for 5 years now, so he's so excited about it.
This last month has been difficult for Arnold. He's now lost 4 Filipino friends living in the UK to the virus and has not long recovered from it himself.
Seems like week after week, I've been posting like, this person died, this person died. I can't believe as well how I'm able to cope up with this. Because every time somebody, passed away, I really cried hard.
What's it been like for the Filipino community during this crisis?
It's sort of frightening because, as I told you, we have no family here. Every time we hear a Filipino died, the impact is you came here for a greener pasture. A few years back, you want a better life. But now, working here, realizing it becomes the means for your death.
Tonight, the care home in which Lani works said he epitomised everything that nursing is about: caring, holistic, kind and compassionate. As the Prime Minister returns to work today, a reminder of the man nursed on the very same ward who gave his life caring for others.
Now, an urgent medical alert has been sent to doctors regarding an apparent rise in the number of cases of children admitted to intensive care, with questions over whether they were severe COVID cases. Our health and social care correspondent Victoria MacDonald is here. Victoria, this will be alarming to parents, but what are the facts?
Well, very alarming, but this has to come with a health warning because the cases that they're talking about are very rare and there is no proof yet that they are related to COVID. So the fact is, experts are being asked to look at what have been maybe a dozen or so cases nationwide and perhaps some in Europe. They've seen a slight rise in the number of children needing intensive care for what's called multi-system inflammatory state. Now, this is a severe response of the immune system, and they're describing something called Kawasaki disease, which can lead to low blood pressure and fluid on the lungs and organs overlapping with toxic shock. So it's not good because these kids are ending up in paediatric intensive care. Is it related to COVID-19? Some of the children have tested positive, but some haven't. And actually the tests aren't that reliable, 100% reliable. So again, they can't say. The reason that this alert has gone out, and I think they would have preferred it not to go out to parents, is that they want doctors to start looking out for this. And this is very important. NHS England, the Health Secretary, the Royal College of Paediatrics and Child Health want to emphasise this. If you are worried about a sick child, contact 111, talk to GPs or call 999.
Victoria, thanks very much. Well, Dr. Joe Brearley is a consultant in paediatric and neonatal intensive care at Great Ormond Street Hospital and joins us from Reading. Dr. Brearley, thanks very much for joining us. What do you understand about what is happening here?
I think what's been set up to now is exactly right. We have a signal that there is a new entity making a few children be very sick and be admitted to intensive care. But the important thing is that for parents, this is very unusual and very rare. For them, the same information as before about if you're worried, contact a healthcare professional, call NHS 111 is in place. This alert was really for us in the kind of the hospitals, just to alert us that this new kind of hyperinflammatory condition maybe making children quite unwell, and some may present in different ways. The important thing about COVID, we don't know if this is related to it at all. The timing is very suggestive. And we do know that some of the toxic shock syndrome type things do follow other infections. The problem is we have this information and it's coming quite quickly, and we don't have all the facts yet. And that's why we're very keen for children's doctors, surgeons, people who might be looking after children with quite bad tummy pain, diarrhea, and the signs of septic shock, to consider this diagnosis, contact infectious disease specialists, and we can try and find out more. And as the lady said earlier, it is something we have just had a conference call. We're seeing in several centres in Europe and certainly in several centres around the UK.
Yeah, so you've been in contact with your counterparts across Europe. What are they telling you about what they're seeing?
The same thing as we've described. So, 10, 15 children in the very big metropolitan centres presenting with this inflammation. We would call it refractory shock. You may have seen the surviving sepsis type stuff, that sort of presentation where the children's vascular system doesn't work so well, and we have to use medicines to help the heart pump better, resuscitate them, provide extra oxygen. But it is very different from the few children with COVID we've seen early on, who often had the same thing as grown-ups with lung infections, respiratory symptoms, and X-ray changes needing oxygen and ventilation. Incredibly unusual, but there were a few. The fact that this is testing negative from the lungs suggests it might not be a primary lung infection. It might well be COVID is infecting the bowel in these children. It might be an immune response to a previous infection that the children have had. We just don't know. And that's why we need to get more information. And the important thing to reiterate was this alert was for medical practitioners to share the very rare cases so we can build more information, work out what's going on, and hopefully lead to better care and treatments.
Anna, you've hinted at this already, but from the outset, the advice seemed to be that children would normally, if they got COVID-19, weren't too poorly with it. Do you think this at least begins to change our understanding of coronavirus?
I don't think so at the moment. And the reason is we can't say with any certainty this is definitely linked to coronavirus. We certainly have had a few children affected, but given that the population of young people in the UK, it's still an extremely small number that have become sick with COVID, and the majority have got better. Many might have had it asymptomatically, as we saw from the Chinese data. So until we get population data from children, we can't really say how many have been affected, and then we would know how many really were made sick by it. But we've seen very few in the intensive care units up to now, but we have seen some.